Is there a way to carry out mass deportation without separating families?
Of course there is. Families can be deported together.
Today, our cities are flooded with illegal aliens. Americans are being squeezed out of the labor force and their jobs are taken. By the way, you know who's taking the jobs that are created? 107% of those jobs are taken by illegal aliens. And you know who's being hurt the most by millions of people pouring into our country? The black population and the Hispanic population, because they're taking the jobs from our black population, our Hispanic population.
New York City is currently housing over 100,000 migrants in emergency shelters. That's more people than the entire population of Albany. Imagine waking up to find your local park transformed into a makeshift shelter, creating a tale of two cities within one. The numbers are staggering. And while the city has spent $1.5 billion on the migrant crisis up to now, it plans for costs of $4 billion by next summer. This invisible city is changing the beat of daily life for all New Yorkers. Certain neighborhoods are seeing their demographic balance quickly change, affecting the businesses that operate in those communities. These newcomers are not just crossing borders, many are crossing whole continents. But why New York? And how are so many making it to a city that is thousands of miles away from the southern border? The road to New York City does not always start in Times Square. For some, it begins en route in countries like Venezuela, Colombia, or Ecuador. The initial stage of their journey includes navigating perilous jungle lands, such as the notorious Darien Gap situated between Colombia and Panama. This 60-mile stretch of dense rainforest and swampland has no roads and is teeming with dangers, from poisonous snakes to armed smugglers. After navigating all of Central America, migrants must then enter Mexico. To evade capture, many take perilous paths atop freight trains nicknamed La Bestia, or the Beast. The journeys are dangerous, often take weeks or months, and migrants risk injury, robbery, or deportation at every turn. But why go through all that trouble to get to New York? One factor that plays into that is the city's reputation as a haven for immigrants. A powerful lure has been New York's right to shelter law, which provides housing for anyone who asks for it. The city offers a blend of job opportunities and its diverse communities, making it an attraction for people looking for change. Texas has sent more than 13,000 migrants to New York City alone since April of last year. A Venezuelan migrant, who asked to remain anonymous for safety reasons, spoke about his experience saying, "We walked for days through the jungle, terrified. Just the vision of New York pushed us. It was a place where we could have a new start. It was better for our children." When migrants arrive in New York, they encounter a fresh round of difficulties. The resources are siphoned, and the welcome's not always warm. It is challenging to find jobs without the right documentation, and shelters are filled to capacity. Still, there are more arrivals than ever. How many migrants have really reached New York City? The numbers are staggering. More than 100,000 migrants have arrived in the city since spring 2022, with around 500 new arrivals every day. That wave has sent the city's shelter system into free fall, with over 60,000 migrants in the city's care today. One of the largest transformed neighborhoods is East New York, Brooklyn. Historically an African American and Latino neighborhood, there are now large numbers of Venezuelan migrants in the U.S. Residents said the identity of their neighborhood changed almost overnight as new businesses aimed at the immigrant community appeared next to long-standing ones. Some neighborhoods, according to the Mayor's Office of Immigrant Affairs, have taken in a disproportionate share of new arrivals. For example, the number of migrants as a percentage of the South Bronx's population is up 15% since last year. Migrant communities have further expanded in Washington Heights, Manhattan, and Sunset Park, Brooklyn. Areas that have pre-existing organizations and services set up to assist immigrants, as well as neighborhoods where people speak the same language or they are directly tied economically, are more desirable and tend to attract new immigrants more often than not. Among them, Corona in Queens has attracted hordes of Spanish-speaking migrants thanks to its existing Latino population. Where migrants eventually land is also affected by how much shelter space there is. Metropolitan's efforts were scrambling to turn buildings in some neighborhoods into temporary shelters as a solution for housing. As a result, there are clusters of migrants in places, like many hotels that have been turned into shelters, Midtown Manhattan. Sometimes the existing communities become hubs for newcomers. Migrants usually move towards a place where their languages, foods, and cultures are already present. This cycle of dispersal and refusal reinforces the adherence to concentrated neighborhoods while allowing it to largely go untouched elsewhere. The consequences on these neighborhoods are starting to emerge both socially and economically. Local schools are struggling to accommodate kids that do not speak English. Small business adjustments to suit different customers, but some who've been around a long time are worried about change in the community. With the situation still in flux this month, it is clear that East New York, parts of the South Bronx, and parts of Queens are feeling most acutely the impact of just what being a sanctuary city means. Much of the burden, but also many of the opportunities presented by rapid demographic change, are being shouldered in these areas. The new front lines of New York City response to the influx. Although the migrants are clustered in specific NYC neighborhoods, which presents short-term challenges to those communities, it raises questions as to whether this will impact New York City's social fabric for a long time. With some neighborhoods changing and others not, the great diversity of New York is being challenged as it never has been. But the story of New York's migrant crisis isn't just about where people live. It's also about how they make a living in a city known for its competitive job market and high cost of living. The question of employment for these new arrivals is sparking debates and reshaping industries across the 5 boroughs. While job competition always was intense in New York City, the recent waves of migrants likely turned up the temperature all the way. New York University labor economist Dr. Maria Rodriguez said migrants frequently fill key holes in the workforce. For this reason, most native New Yorkers don't take up these jobs, which are in low-paying fields like agriculture, construction, and food service. In reality, migrants are working in a broad range of industries. Many restaurants in the food service sector now heavily depend on migrant labor. For its part, the construction industry, as Thompson pointed out, has absorbed an influx of migrant labor. Migrants with professional backgrounds are also contributing in even more specialized fields, and the long time it takes many asylum seekers to receive a work permit has caused some to resort to the underground economy, and it makes life hard not just for the migrants themselves, but also for businesses which must ensure that they are complying with labor laws. As the city grapples with these employment challenges, another equally complex issue is unfolding in New York's classrooms. The education system, already strained by years of budget cuts and pandemic disruptions, now faces the daunting task of integrating thousands of migrant children into schools across the 5 boroughs. When you walk into your child's classroom and find it doubled in numbers overnight with students talking a dozen languages, and while this might sound like a dreaded hypothetical scenario, for many NYC schools it is the new normal. With thousands of migrant children streaming into the system, this could be a make-or-break moment for teachers, and perhaps even a watershed for how the city teaches. New York City's already strapped school resources have been hit by the influx of migrant students. Where classroom sizes were once 25 max, they now number at least 35, and some schools reported an increase up to a full 1/5 extra in enrollment. This increase is not just a number, it reflects the various needs of these new students. The most significant challenges arise from language barriers. The majority of migrant children come with little or no English experience and need special programs for English as a second language. Cultural variations create another layer of complications. Thousands of them endured violence or other traumatic events to reach the U.S., and many need mental health care that schools are ill-equipped to offer. The hospitals in New York City were already stretched then came the migrants. New York's healthcare system, once the pride of millions, now it's verged to a death. With waves of newcomers filling emergency rooms and clinics, doctors and nurses are confronting a crushing crisis that is testing the bounds of their endurance. This on top of NYC's existing staffing shortages and budget challenges that predated the migrant influx. Much of the money was created in razor-thin margins for years due to financial difficulties. Emergency rooms had a reputation for extremely long wait times, and specialists often had appointment backlogs measured in months. It was held together by a fragile balance with little room for expansion. Hospitals in the 5 boroughs were suddenly inundated with patients like nothing they had ever seen before. New arrivals began flooding into emergency rooms, seeking treatment for everything from minor complaints to serious complications due to prolonged and arduous travel. One ER physician at a Queens hospital stated there had been an uptick of 30% patients seen per day, with many requiring complicated treatment for diseases put off for long periods. The situation has become even more complicated due to the specific health difficulties that migrant populations experience. Many come with diseases the U.S. rarely sees, like a parasitic infection or tropical disease. Another commonality includes mental health problems, as many are suffering from traumas from their journey. Language barriers further complicate matters, with hospitals scrambling to find interpreters for dozens of different languages and dialects.